This is an interview about the Canadian healthcare system, and I'm sitting with Edith from Saskatoon.
I was diagnosed or told I had a mammogram with a biopsy requirement, and the surgeon told me I'd be in the hospital within 2 weeks. I waited my 2 weeks, and the doctor's office hadn't called me, no one phoned me, so I phoned the booking girl in the hospital to see exactly what was going on, like when is this procedure going to happen. The surgeon didn't know the date, my family doctor didn't know the date, and the booking girl told me that they hadn't even received the order yet to book me for a biopsy.
And this was after you've waited the 2 weeks already?
After I waited my 2 weeks, which the surgeon told me I would probably be in within the 2 weeks.
Right. Okay.
And they told me, the booking girl said no, that they have a policy of 5 or 6 weeks to get in before, and they hadn't even received my order yet, but I was on the list. So then I thought, gee, this is October, so now we're getting around the first part of November. And I knew then 6 weeks would bring it till Christmas, and you know what happens at Christmas time, the system closes down just about. In fact, I can safely say they really do. And then after Christmas, there's going to be all these catch-up people that will have either more serious conditions or bigger priorities or whatever. So I knew it would be at least 3 months before I'd get into the hospital.
Wow. Now, there's a lot of people that say that the Canadian medical system is pretty good. How do you feel about that?
I can understand a lot of people saying that because in some ways it is really excellent. Just not too long ago I was in Saskatoon and I fractured my kneecap. On a Saturday afternoon I went to a minor emergency, a walk-in clinic, and I picked one that had an x-ray lab attached to it because I knew there was something pretty major wrong. And I had an hour wait, went in to see the doctor at exactly 7 o'clock, and I walked in his office. He sent me for an x-ray. They did the x-ray immediately. I came back to his office. Within 10 minutes he told me I had a fractured kneecap. He told me he had someone left behind a removable cast. Right. Okay. He said you can have it. I don't even have to pay for it. He sold me a set of used crutches for $25, and within 20 minutes I had my fractured kneecap treated and out.
Okay.
Now, but if it had maybe been anything a little more, I would have been in trouble. If it would have required further testing, it wouldn't. I don't know how long it would have taken. Okay. Some areas of the healthcare are absolutely fantastic. And then again, I tell everyone it has to work sometimes, because if it didn't, even for advanced, but to get into specialists and that's very difficult. So I can understand the average person who doesn't have to deal with the health system at all saying that it is, because I was extremely pleased with my knee. Extremely pleased with the doctor. I thought it was wonderful, but I just thank God that it wasn't anything more serious. You know, if you fall into the system, you're okay. But if you happen to step out of it, it's very hard to get back into it.
The word two-tier healthcare, they don't like that.
Yes, I agree with that, but I don't. I think that I've looked into all the different systems in the world that are using the two-tier, and they're working really beautifully. Every system, nothing's perfect. We're all human beings. But I say the two-tier system is almost essential. And I know my husband and I save our little bit of money for health care. Especially when they talk about how you in your last 6 months of your life use all your health care. But I say that's what I worked all my life and paid taxes for, was so the last 6 months of my life I could have health care. And so I don't understand this. The world thinks differently than I do. And I don't understand why people find a two-tiered system so hard to comprehend. I can't see the injustice. I think it's I still have to pay the same tax to support the same system, even if I take extra money and go on the side. So why? I don't understand it.
I mean, if people can take their dog for treatment when they need it, why can't they take themselves for treatment?
I hate to tell you this, but I've often said, I'd love to be my dog. My dog just had a $3,000 surgery. Would you believe they phone me every day for a couple of days after to make sure he's okay?
Wow.
Yes. And even 2 weeks later they phone me. And they phone me and say, how come you're not bringing him back? We want to see him. Well, they don't want to ever see me again.
Yeah,
They just,
right.
you know, get out, gone, be gone.
Yeah.
Oh yeah, I would love to have my vet as my health care.
Right.
Because he cares. And
Yeah.
I don't mean that the individual doctor doesn't care.
Right.
But he's working in a system that doesn't allow him the potential to work the way he wants to.
Right.
I think the doctors have a hard life. Their hands are tied. And they can't tell you, the patient, what's really going on because they're really tied. If I'm scared to say something, I can't even imagine how much they must be limited in what they speak out, because we all have to keep living and surviving.
Let's talk about the right to health care. Do you feel in Canada that when you are delayed 3 months for important surgery, breast cancer surgery, that they're exercising that right?
No, you don't. That's not health care. I don't feel that when I had breast cancer and I had to wait for 3 months, that was like a death sentence to me. It really was. You know, with the possibility that you could have cancer and what's it doing? I mean, to me it's a death sentence. So, no,
In Canada, you don't have the right to health care. You have the right to access to a waiting list? Is that a good way to put it?
That's how I feel. That's how I feel. Like you're always on a waiting list. We have to take responsibility for ourselves. So if I'm willing to take the responsibility and pay for another form of health care for myself, I don't understand why that's so bad. I just can't see it, because it's my life. I work for the money, and it's my right.
There are a lot of people that criticize the American system because it's more expensive, but that extra money buys the greater technology.
Yes, but they talk about it being more expensive. My room at the Mayo Clinic that I had at the hospital now, I can't remember which hospital I was in, because St. Mary's is one. I wasn't in that one. I was in the other one at Rochester, Minnesota.
Right.
And my room was $360 for the night. I had my own television. I had stereo speakers. I had my own phone. I had a push button to the nursing station 100% of the time. My husband phoned me that night after my lymph nodes were out about 8 o'clock, and he said, my gosh, the hospital just phoned. And my stomach just went to the floor, because I thought, oh my God, what's happening? What's going wrong? And he said, oh no, they just phoned to make sure you were okay. If we understood what happened to me today, if he understood, and was there any questions or problems? Now my mother was waiting for open heart surgery in Saskatoon at the time. She was in I was in a 2-bedroom. There was 2 beds, but we each had our own TVs.
Right.
My mother was in a 4-bedroom, and they said her room was $600 a day. So I'm not just sure that the American system is more expensive. I think we just don't know what's going on here. Right. And we're not wealthy people. The last thing we are, everyone says, oh, we could afford it. I'd sell my house. I'd sell my car. I would sell everything if I had to have health care. I mean, when you're really critically ill, money means nothing.
Right.
The only time it has meaning is when you don't have it to pay it.
Yeah, yeah.
So really, and when people say that, it upsets me, because we're not rich people. Okay. Because really, the most critical thing in our lives is health care.
Right.
It is the most important thing. If you don't have your health, you have nothing.
Yeah, true.
It doesn't matter how much money in the bank. It doesn't matter how many kids you've got. It doesn't matter how much a family. If you don't have health care.
If you were to move from Saskatoon to Winnipeg, for example, might you have a hard time finding a new family doctor?
Yes, I would say so. And we have been blessed the few times we've had to change, that we've run across good doctors. But I hear a number of people have had difficulty. The more healthcare problems you have, the less likely they want you as a patient. So therefore, as you get older, and if you have some health issues, it is a concern. Because the doctors are shortage of doctors. So you can't blame them for wanting to take the the path of least resistance. It's normal. It's
Right.
human.
Yeah.
I mean, that's I can't say I wouldn't even do that. I would do it myself. I mean,
Right.
I think the difference that I felt between the Mayo Clinic and going here in Canada was that at the Mayo Clinic, they're not perfect. Now, I don't mean to. I'm a realist. They make errors too, but the system there was really trying to put the patient number one. What I find in our healthcare here, it's the system that's number one. I have people waiting for a life and death cancer surgery now because the one neurologist is on holidays.
Wow.
You know, and they're waiting, and they don't even know if they're going to make it to when he gets back. Well,
Really?
you know, like you kind of say, now is the system working for him? No, the system is working for the system. I don't want to rely on the government for everything. I don't think we should rely on the government for everything. I think we have to take responsibility.
Absolutely.
And that's how I see with my health care. When I go outside of the system, it's not against any system. It's for me taking personal responsibility for myself. And some of us worked hard to save some money so we could do that.
Right.
I would love to buy a bigger motorhome, and I'd love to fly another trip somewhere, but we don't because you never know.
Well, I understand that sometimes in Canada, if you speak out or if you even question your doctor's recommendation of treatment, that it can cause problems.
I'm very hesitant. I don't want to cause myself. I need the system. I need my doctors. I need them behind me. I have to have them because they're my front line to my security for health care.
Right.
So yes, I think I can understand people being hesitant to even say what I'm saying now.
Right, right.
Because they don't want to be blacklisted. But I can say that, like I said, we never had one thing done at the Mayo Clinic that couldn't have been done in Saskatoon. It's just that we couldn't somehow work to access it properly.
Right, right. So the biggest problem in your experience is access in Canada.
Access.
It's not coverage, it's access.
Access. Oh no. Yeah, just access.
Okay.
And like I said, people think our healthcare is wonderful, and it is. If you're going to have a baby, oh, that's wonderful, just absolutely marvelous. If you have an emergency appendectomy, wonderful. You go into the hospital, you get it done. But if you need further cancer treatment and things aren't going too good, and to try to, you need surgery, it's pretty rough.
Yeah, yeah.
And you would say, oh, well, if you really need it, you're going to get it. Well, it just depends how the system can manage to get you in. Like,
Right.
And I think our society is developing a bias. Like we developed a bias against people that smoked. Now we've got this bias against people that are getting older. And there's, making all these claims, and there's a prejudice against them almost. Or I'm not just sure what it is, but... and that doesn't do anything for your access to health care neither, because, gee, in fact, I told them in the hospital, my mom was in there, I said, my mom was in there and I felt that she wasn't going to live, but I said, if I find that young guy there that put his hand through the wall because he was mad at somebody, if he's going to get priority over my mother, I will fight. Right. Because my mom has a right to access, even if she is older, to be taken first too, because she's in a life-threatening situation.
We have a company called MediBid, which allows you to go online on the computer and put down your health profile and what kind of treatment you want. And then doctors from throughout the U.S. and overseas will provide a bid on providing that care. So you'll have different bids, and you can look at their medical background, their experience, their training, and then make the decision so you know the price is going in. Yeah,
that's excellent. That we would have used that. Now that we're getting older, travel is getting a little more difficult for us. But oh yes, we would have used that. That's one service we would have used. Because I know there are systems out there. The one we know about, I talk about the Mayo, but that's really the only one that I have a good basic fundamental knowledge about. And because of the history about my parents going there. And the closest one. So maybe Houston Medical Center or something is just as good. I don't really know. There's a lot of good cancer hospitals too I don't know about.